Have you ever thought about how a really simple idea can have a massive impact? Well, today we're diving into an incredibly powerful system. It's so simple, yet so effective, that it's saving thousands of young lives, using a logic that every single one of us already understands.
I know, it sounds like a riddle, right? But what if I told you that the simple logic of red, yellow, and green has been turned into one of the most effective tools in global child health? Stick with me because the answer is nothing short of brilliant.
So, where does this whole story begin? Well, it starts with a tragic but totally solvable problem. Way too many children under the age of 5 were dying from preventable illnesses. We're talking about kids in communities far from the nearest hospital with no easy access to a doctor. And this really lays out the stakes. You have this perfect storm of high mortality rates, very few doctors in remote areas, and that means common, totally treatable sicknesses like pneumonia or diarrhea can suddenly become fatal. The big challenge wasn't a lack of medicine, it was the need for a simple, reliable system that could work anywhere and could be used by anyone with just some basic training.
And that's exactly where this life-saving blueprint comes into play. You had global health organizations like the WHO and UNICEF working hand in hand with governments, like the one in Nepal, to develop a structured, community-focused way to tackle this problem head-on.
It's called CB-IMCI. Yeah, it's a bit of a mouthful, I know. But the most important words in there are community-based. This whole strategy isn't about building more fancy hospitals. It's about empowering local health workers right there in the villages and remote areas, giving them the tools to make life or death decisions quickly and, most importantly, accurately.
And this right here is one of those tools. This simple booklet from Nepal's Ministry of Health contains the entire system. Think of it as a flowchart, a diagnostic guide, and a treatment plan all rolled into one beautiful package designed to be used out in the field. Inside here lies that amazing color-coded algorithm we're about to break down.
Okay, so the system starts by being incredibly smart and simple. And this is a key point, especially for your exams. It splits all sick children into just 2 groups: young infants, from birth up to 2 months, and then children from 2 months all the way to 5 years. Now, why do that? Well, it's because a newborn shows signs of a serious illness very, very differently than a toddler does, and their risks are completely unique.
Now, at the very heart of this entire program is a simple 3-step mantra. This is something every health worker learns, and it's the engine that drives every single decision they make. Assess, classify, treat.
Let's walk through this because it's so elegant. First, you assess the child. You ask the mother questions, you check for specific signs. Second, based on what you find, you classify the illness using that color code we talked about. And finally, that classification tells you exactly how to treat. Does the child need medicine, counseling for home care, or an urgent referral to a hospital? Say it with me. Assess, classify, treat. Simple, powerful, and repeatable.
The assessment always starts with the most critical step, checking for what the system calls general danger signs. You can think of these as universal red flags that scream life-threatening condition, no matter what the underlying illness might actually be. And here they are. You have to ask, is the child unable to drink or breastfeed at all? Are they vomiting up everything? Have they had convulsions or fits? Or are they lethargic, kind of floppy, or even unconscious? Any single one of these is an immediate major alarm bell.
Okay, now we get to the absolute core genius of this system. Once the health worker has assessed for all the signs, they move to classification. And this is where that traffic light analogy from the beginning becomes a real, powerful, life-saving tool. And this chart illustrates the decision-making process perfectly. This is super high yield, so listen up. If a child has any of those general danger signs we just mentioned, or other really severe symptoms like chest indrawing, their condition is classified as pink. Think of this as the system's flashing red light. It means stop everything, this is an emergency, refer this child to a hospital immediately. Now, if the signs are less severe, it's classified as yellow, kind of like proceed with caution. This calls for a specific treatment, like an antibiotic or oral rehydration salts. And finally, if the symptoms are mild, it's green. This means go, but with care. The health worker gives counseling and clear instructions for home care. Red, yellow, green, simple as that.
And this rule right here just underscores how high the stakes are. For the youngest infants, those under 2 months old, there is zero ambiguity. Any single danger sign automatically classifies them as pink. The only correct action is an urgent referral to a hospital, period. Often, they'll give a first dose of an antibiotic just to buy some precious time.
Okay, let's make this real. Imagine a community health worker is looking at a 6-month-old baby. The mother's worried, says the baby is breathing really fast. When the worker looks, they see severe chest indrawing. That's when the skin between the ribs sucks in hard with every single breath.
So, based on what we've just learned, what's the call? What color does this case get? Pink, yellow, or green?
It's pink, absolutely. Severe chest indrawing is a classic sign of severe pneumonia. The system gives a clear, unambiguous answer. This child needs a hospital, right now. There's no guesswork. The color code leads directly to the life-saving action.
So, the system itself is brilliant, right? But it's the people using it who are the real magic. This is all about transforming local health workers, who often have limited formal education, into bona fide community health heroes.
So why is this program so darn successful? Well, it empowers people on the ground with clear, consistent guidelines they can trust. It means that these crucial, life-saving assessments don't have to wait for a doctor to show up. It also improves the health knowledge of the whole family through counseling on things like feeding and hygiene. Ultimately, it doesn't just treat sick kids. It strengthens the entire community health system from the ground up.
And that really leaves us with a final thought to chew on. This system took an incredibly complex medical problem, child mortality, and created a solution with a simple, elegant framework of colors and clear steps. It really makes you wonder, what other huge challenges, in health or even beyond, are just sitting there, waiting for their own version of a life-saving color code?